As COVID-19 cases surge across the U.S., the Rockefeller Foundation has proposed a new $75 billion effort to bolster the country's coronavirus testing and contact tracing capabilities. The U.S. currently tests an estimated 4.5 million people per week, which experts say is not nearly enough. In order to reopen and keep the U.S. economy afloat, the Rockefeller Foundation suggests we must boost our efforts to 30 million tests nationwide each week. Dr. Rajiv Shah joins me now. He is the president of the Rockefeller Foundation. Welcome, Dr. Shah. Great to have you with us. So, as you know, COVID-19 is a global issue, but here in the United States, it's being addressed on a state-by-state and city-by-city basis. How does your plan address this lack of uniformity, and what do you propose we do to bolster our testing efforts?
Well, thank you, Tanya. As you pointed out, America needs to rethink its approach to testing. Otherwise, we have two options: let tens, maybe hundreds of thousands of more Americans die, or go back to the national lockdowns and shutdowns that have caused so much economic pain, suffering, and importantly, learning loss for America's communities, particularly lower income and minority communities. The only way out is more testing. So we have pulled together former Republican officials, Democratic officials, scientists, industry leaders, and proposed a practical plan to hit 30 million tests a week. It starts with making major investments in new types of tests. They're called rapid antigen tests, pooled testing and LAMP tests, things that can produce results in 15 or 20 minutes. In most of America, testing is now taking 5, 7, maybe even 9 or more days, and that renders it basically ineffective at taking those who are positive out of the chain of transmission. This is a responsible strategy. It is bipartisan, and it would allow for government to come together with industry and get America moving at a time when we're otherwise facing a fall season that's likely to be worse than the spring.
And tell us a little bit more about these tests you're proposing, these rapid tests. How are they conducted? Are they saliva tests, nasal swabs? Are they as easy to administer to children as to adults?
Yeah, there's a whole variety, and they can be both, and they are easier to administer. Some of them have a machine that requires, putting the cartridge in the machine, so it's not something you would do as a home kit, although we expect within maybe 8 to 10 weeks, there will be some home kits that are like pregnancy tests or HIV tests that would be effective for people to use in their homes. And the idea is very simple. I think right now we're seeing sports leagues across America test their players to give them the confidence that they can participate in their work and do so safely. And all we're asking for is that America treat nursing home residents, healthcare providers, essential workers, and importantly, teachers with the same level of commitment to their safety and make them confident that they can go to work. And these new tests are maybe $10 to $15 relative to $50 or more for the traditional PCR test. And so now is the time to scale up their manufacturing. So America has literally 100 million plus of these types of tests on a per month basis.
So the idea is before you leave your house to go to school or to go to work, wherever it may be, if you have any doubt, you can quickly test yourself and enter your workplace or your school with confidence that you are not an asymptomatic carrier.
That's part of it. I would say, if you look, actually, the federal government just announced this kind of approach for nursing homes in specific parts of the country that have higher prevalence of COVID-19. And they've used a Becton Dickinson test and a Quidel test that produce results in 15 minutes and said they're going to, follow Rhode Island's lead, really, and test every nursing home residents and healthcare provider on a weekly basis. That ought to be sufficient for these new screening tests to screen out those that are positive. And that approach maybe once a week, once every other week, would be a viable approach in most American essential institutions, such as schools and healthcare settings in particular. You probably don't need everyone to take a test on their own every day, because all you're really trying to do is take people who are positive out of the chain of transmission and do it quickly. We know that fast and frequent testing is much more effective than waiting 5, 7, 9 days for a test result, because you would have contaminated, or the contagion would have already happened by the time you find out you're positive.
Right, and so that's the other important part here is the results, getting the results quickly, within a time frame in which they're actually useful to you, like as you pointed out. Now, the Rockefeller Foundation's plan calls for $75 billion in funding in order to fix these testing issues across the U.S. and to implement the plan that you just laid out and discussed. So where did this number come from? How did the foundation come to this number, first off? And from where do you expect this funding will come?
So the number comes from actually a plan we put together back in the spring. We called the 1-3-30 plan to get to 3 million tests per week in the spring, and then 30 million tests a week in the fall. And our estimate was that would cost $100 billion. Congress allocated about $25 billion in the original CARES Act, and so this is a request for the remaining $75 billion. That money could be used to expand investments in tests that are coming to market. It importantly could be used, as we're doing with the vaccine, to create advanced purchase contracts and really, create the kind of manufacturing capacity so that there are many, many, many more tests available. Right now, if you go to a school district and say, do this, they say, gosh, I called around, I can't get the Quidel test, I can't get the Becton Dickinson test. I just had those calls this morning. So making sure the capacity exists for America's essential institutions to gain access to these types of tests is where the bulk of those resources should go. And then part of it is changing and fixing the kind of reimbursement approach so that more people have coverage for those types of tests. Most countries that have succeeded at using testing to get on top of this pandemic have made it free and ubiquitous and effective and fast. And by the way, 75 billion might seem like a lot in one context, but every month we lock down our economy, we lose $350 to $400 billion. We are spending north of $3 trillion in fiscal stimulus. This is probably the most effective money you could spend if your goal is to allow kids to go to school and keep essential parts of our economy safe and open during an absolute crisis.
All right. Well, Dr. Rajiv Shah, thank you so much for outlining this plan that the Rockefeller Foundation is proposing. It's very intriguing, and we wish you well. It sounds great. Thank you so much.
Thank you.